Welcome back to TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us now is Mary Ellen Kilgus, Cardiac Rehab Nurse Lead with McLaren Bay Region. Thank you so much for being here. How are you today?
I'm doing well. Thank you for having me.
Of course, you're welcome. So we're talking all about cardiac rehab. So tell us, what is that, Mary Ellen?
Well, cardiac rehab is a program that is designed for patients who suffer from all sorts of cardiovascular diseases. And the goal is to try to help improve their overall health and well-being, reduce their risk factors, and hopefully reduce their disease progression as well. We offer education as well as monitored exercise sessions throughout the program. The education topics we cover include exercise, stress management, nutrition, risk factor reduction, smoking cessation, things like that, along with the exercise.
Wow, wide variety of things.
Yep.
Okay, so what types of patients, Mary Ellen, qualify for cardiac rehab?
Well, lots of different types of cardiovascular disease patients qualify.
Okay.
For example, if someone's had open heart surgery, whether it be coronary bypass or if they've had a valve repair or replacement, they would qualify. Also, patients who have less invasive procedures to replace or repair their valves, such as a TAVR or a mitral duct, they could qualify. Patients who have coronary artery angioplasty with stenting, patients who've had heart transplants or heart attacks, or even those who have a diagnosis of heart failure or angina would qualify as well.
Mary Ellen, if a patient's going in for cardiac rehab, what does a typical session look like?
Initially we do like an evaluation session where the patient comes in and we get their starting point. So we see what their exercise tolerance is, what their needs are, so that we can establish their initial treatment plan to move forward. And then from there, we can progress their exercise based on their needs and what they need to get from us. Each daily session typically starts with the patient coming in to cardiac rehab. They get a heart monitor hooked up so that we can watch their heart rate and EKG. They'll get a blood pressure check to start, as well as get weighed on our scale every time they come in, so we can monitor that as well. Then the session will proceed first with a warm-up session. So we'll take them through some warm-up exercises to slowly bring their heart rate up and get the heart ready for exercise. And then in the middle, they do the cardiovascular exercise, which that part will vary for each person because everyone has different needs and abilities. But they'll usually exercise on several different types of exercise equipment, things so that they can get a variety of exercises in. And then at the end, they will go through a cool down exercise, which is to help bring the heart rate slowly back down to where it was when we started, but also to stretch out those other muscles that they've used so they don't experience an injury. Typically, we monitor the heart rate, the heart rhythm the entire time they're exercising with us. We also check their blood pressure throughout the session, and we're checking with them to see if they have any symptoms and how they're tolerating the exercise as well.
That's great. It sounds like it's a very comprehensive session for patients there. Now, can someone who has other health problems, can they attend cardiac rehab, Mary Ellen?
Yes, of course. We are able to accommodate patients of all different backgrounds. So anybody can come into us, even if they have other issues. We have a lot of different exercise equipment and types of exercises that we can work with, and we're always flexible. So if we try something and it doesn't work, we try something else to try to continue to help that patient and get them the best outcomes that we can. So even if someone, we have people come in that say they have hip problems or knee problems, and they think that cardiac rehab is all about walking on a treadmill, but that's not the case. We've got lots of other things we can do, and we can accommodate a wide variety of people and from all different backgrounds.
Mary Ellen, if a patient says, I don't know if this is for me, what would you say the benefits are of cardiac rehab?
Oh, there are lots, and cardiac rehab is very strongly supported by evidence-based research out there.
Excellent.
Cardiac rehab is proven to reduce disease progression as well as reduce mortality and future cardiovascular events. It will help to reduce risk factors such as high blood pressure, high cholesterol. We can help people with their nutrition and kind of get on track with that. sometimes just having the support of trained professionals and other patients who are going through similar things as them as well will really help improve their confidence and their overall emotional health. We, can help them reduce symptoms. So those people that might experience recurrent chest pain or shortness of breath, the regular exercise will help to control and let them know their limits as well.
And it sounds like the people who work with those patients really get to know the patients so well, and that is so important for rehab.
Yeah.
So talk to us about this, Mary Ellen. How long are the sessions, and for how long do patients attend for?
Yeah, so each exercise session typically lasts about an hour. And then the education sessions that we offer are about 15 to 20 minutes. So they might be with us anywhere from an hour to an hour and a half, depending on the day. The exercise sessions, usually we schedule 3 times a week, because typically the more often the patient can come, the better outcomes, whereas the education sessions are only 2 times a week. The length of time we have with patients varies. Everyone has different needs and different goals, but typically many patients can get covered for up to 36 sessions by their insurance. So, and we usually find that the more sessions they do attend, the better the outcomes, and the better they feel when they're done with us too.
Mary Ellen, what's so appealing is you're not only getting the physical exercise, you're also getting the education as well. I love that. Yeah, now does someone need to be referred to cardiac rehab by their physician, or can they just come all by themselves?
They don't necessarily have to be referred to start that process of getting going with cardiac rehab, although we do eventually need a physician order for them to come. Okay. But we usually help them with that. So anybody who suffers from any of the cardiovascular diseases that I already mentioned a little bit ago can come. They just need to call the cardiac rehab program that they live closest to. So they would just call. The cardiac rehab team would typically work with their physician to get the physician order signed and get any documentation that's needed. And they would also help to work with the insurance company that the patient has to make sure they're covered and let them know ahead of time what their coverage is exactly. So typically the sooner patients get started after having a procedure or getting diagnosed, the better. But a lot of times patients can still get going even up to a year after that procedure or diagnosis. So it's not necessarily too late if it's been, a few months since your procedure. You just gotta, get on the phone and call the program, and you can ask questions and we'll help get you going.
Well, Mary Ellen, you certainly have given us some great information. Anything you'd like to add that we haven't covered that you think is important for folks to know?
Not necessarily. If you have questions, even if you're unsure about it, give us a call. We're willing to talk to you and answer any questions to make you feel more comfortable. And you can always come in and do an evaluation session. It gives you a better idea to know what we're all about and how it's going to work for you.
I love that you added that. Make sure you call. Don't hesitate if you do have a question. Mary Ellen, thank you so much for calling in with this valuable information. We'd love to have this right in our area. We appreciate you.
Yes, you're welcome. Thanks for having me.
Of course, you are so welcome. If you would like any more information, head on over to the Aging and Style page. That's at WNEM.com.